a WikiVidi Documentaries production. Don't forget to like and subscribe. Enjoy. Amyotrophic lateral sclerosis. Amyotrophic lateral sclerosis, also known as motor neuron disease and Lou Gehrig's disease, is a specific disease which causes the death of neurons controlling voluntary muscles. Some also use the term motor neuron disease for a group of conditions of which ALS is the most common. ALS is characterized by stiff muscles, muscle twitching, and gradually worsening weakness due to muscles decreasing in size. This results in difficulty speaking, swallowing, and eventually breathing. The cause is not known in 90% to 95% of cases. The remaining 5–10% of cases are inherited from a person's parents. About half of these genetic cases are due to one of two specific genes. The underlying mechanism involves damage to both upper and lower motor neurons. The diagnosis is based on a person's signs and symptoms, with testing done to rule out other potential causes. No cure for ALS is known. A medication called riluzole may extend life by about 2 to 3 months. Non-invasive ventilation may result in both improved quality and length of life. The disease can affect people of any age, but usually starts around the age of 60 and in inherited cases around the age of 50. The average survival from onset to death is 2 to 4 years. About 10% survive longer than 10 years. Most die from respiratory failure. In much of the world, rates of ALS are unknown. In Europe and the United States, the disease affects about 2 to 3 people per 100,000 per year. Descriptions of the disease date back to at least 1824 by Charles Bell. In 1869, the connection between the symptoms and the underlying neurological problems was first described by Jean-Martin Charcot, who in 1874 began using the term amyotrophic lateral sclerosis. It became well known in the United States in the 20th century, when in 1939 it affected the baseball player Lou Gehrig, and later worldwide following the 1963 diagnosis of cosmologist Stephen Hawking. In 2014, videos of the Ice Bucket Challenge went viral on the internet and increased public awareness of the condition. Classification: ALS is a motor neuron disease, also spelled motor neuron disease, which is a group of neurological disorders that selectively affect motor neurons, the cells that control voluntary muscles of the body, including amyotrophic lateral sclerosis, primary lateral sclerosis, progressive muscular atrophy, progressive bulbar palsy, pseudobulbar palsy, and spinal muscular atrophy. ALS itself can be classified a few different ways: by how fast the disease progresses, by whether it is inherited or sporadic, and by where it starts. Most commonly, the limbs are affected first. In this case, neurons in the brain and in the spinal cord are dying, and this form is called limb onset. In about 25% of cases, muscles in the face, mouth, and throat are affected first, because motor neurons in the part of the brain stem called the medulla oblongata start to die first, along with lower motor neurons. This form is called bulbar onset. In about 5% of cases, muscles in the trunk of the body are affected first. In all cases, the disease spreads and affects other regions. The symptoms may also be limited to one spinal region. Those with leg amyotrophic diplegia and brachial amyotrophic diplegia have a longer survival compared to classic onset ALS. Signs and symptoms: the disorder causes muscle weakness, atrophy, and muscle spasms throughout the body due to the degeneration of the upper motor and lower motor neurons. Individuals affected by the disorder may ultimately lose the ability to initiate and control all voluntary movement, although bladder and bowel function and the muscles responsible for eye movement are usually spared until the final stages of the disorder. Cognitive or behavioral dysfunction is present in 30–50% of individuals with ALS. Around half of people with ALS will experience mild changes in cognition and behavior, and 10–15% will show signs of frontotemporal dementia. Repeating phrases or gestures, apathy, and loss of inhibition are frequently reported behavioral features of ALS. Language dysfunction, executive dysfunction, and troubles with social cognition and verbal memory are the most commonly reported cognitive symptoms in ALS. A meta-analysis found no relationship between dysfunction and disease severity. However, cognitive and behavioral dysfunctions have been found to correlate with reduced survival in people with ALS and increased caregiver burden. This may be due in part to deficits in social cognition. About half the people who have ALS experience emotional lability, in which they cry or laugh for no reason. Sensory nerves and the autonomic nervous system are generally unaffected, meaning the majority of people with ALS maintain hearing, sight, touch, smell, and taste. Initial symptoms. The start of ALS may be so subtle that the symptoms are overlooked. The earliest symptoms of ALS are muscle weakness or muscle atrophy. Other presenting symptoms include trouble swallowing or breathing, cramping, or stiffness of affected muscles, muscle weakness affecting an arm or a leg, or slurred and nasal speech. The parts of the body affected by early symptoms of ALS depend on which motor neurons in the body are damaged first. In limb-onset ALS, people first experience awkwardness when walking or running, or even tripping over or stumbling may be experienced, and often this is marked by walking with a dropped foot, which drags gently on the ground. Or if arm-onset, difficulty with tasks requiring manual dexterity such as buttoning a shirt, writing, or turning a key in a lock may be experienced. In bulbar-onset ALS, initial symptoms will mainly be of difficulty speaking clearly or swallowing. Speech may become slurred, nasal in character, or quieter. There may be difficulty in swallowing and loss of tongue mobility. A smaller proportion of people experience respiratory onset ALS, where the intercostal muscles that support breathing are affected first. Over time, people experience increasing difficulty moving, swallowing, and speaking or forming words. Symptoms of upper motor neuron involvement include tight and stiff muscles and exaggerated reflexes, including an overactive gag reflex. An abnormal reflex commonly called Babinski's sign also indicates upper motor neuron damage. Symptoms of lower motor neuron degeneration include muscle weakness and atrophy, muscle cramps, and fleeting twitches of muscles that can be seen under the skin, although twitching is not a diagnostic symptom, and more of a side effect, so twitching would either occur after or accompany weakness and atrophy. Progression. Although the order and rate of symptoms vary from person to person, the disease eventually spreads to unaffected regions, and the affected regions become more affected. Most people eventually are not able to walk or use their hands and arms, lose the ability to speak and swallow food in their own saliva, and begin to lose the ability to cough and to breathe on their own. The rate of progression can be measured using an outcome measure called the ALS Functional Rating Scale Revised, a 12-item instrument administered as a clinical interview or self-reported questionnaire that produces a score between 48 and 0. It is the most commonly used outcome measure in clinical trials and is used by doctors to track disease progression. Though the degree of variability is high and a small percentage of people have a much slower disorder, on average, people with ALS lose about 0.9 FRS points per month. A survey-based study amongst clinicians showed that they rated a 20% change in the slope of the ALS as being clinically meaningful. Disorder progression tends to be slower in people who are younger than 40 at onset, are mildly obese, have disorder restricted primarily to one limb, and those with primarily upper motor neuron symptoms. Conversely, progression is faster and prognosis poorer in people with bulbar onset disorder, respiratory onset disorder, and frontotemporal dementia. The CX3CR1 allelic variants have also been shown to have an effect on the disorder's progression and life expectancy. Late stages. Difficulty in chewing and swallowing makes eating very difficult and increases the risk of choking or of aspirating food into the lungs. In later stages of the disorder, aspiration pneumonia can develop, and maintaining a healthy weight can become a significant problem that may require the insertion of a feeding tube. As the diaphragm and intercostal muscles of the rib cage that support breathing weaken, measures of lung function such as vital capacity and inspiratory pressure diminish. In respiratory onset ALS, this may occur before significant limb weakness is apparent. Most people with ALS die of respiratory failure or pneumonia. Although respiratory support can ease problems with breathing and prolong survival, it does not affect the progression of ALS. Most people with ALS die between 2 and 4 years after the diagnosis. Around half of people with ALS die within 30 months of their symptoms beginning, and about 20% of people with ALS live between 5 years and 10 years after symptoms begin. Guitarist Jason Becker has lived since 1989 with the disorder, while cosmologist Stephen Hawking lived for 55 more years following his diagnosis. But they are considered unusual cases. Most people with ALS die in their own home, with their breath stopping while they sleep. People rarely choke to death. Genetics. About 5–10% of cases are directly inherited from a person's parents. Overall, first-degree relatives of an individual with ALS have a 1% risk of developing ALS. A defect on chromosome 21, which codes for superoxide dismutase, is associated with about 20% of familial cases of ALS, or about 2% of ALS cases overall. This mutation is believed to be transmitted in an autosomal dominant manner, and has over 100 different forms of mutation. The most common ALS-causing mutation is a mutant SOD1 gene, seen in North America. This is characterized by an exceptionally rapid progression from onset to death. The most common mutation found in Scandinavian countries, D90A SOD1, is more slowly progressive than typical ALS, and people with this form of the disorder survive for an average of 11 years. In 2011, a genetic abnormality known as a hexanucleotide repeat was found in a region called C9orf72, which is associated with ALS combined with frontotemporal dementia, and accounts for some 6% of cases of ALS among white Europeans. Head injury. While moderate to severe traumatic brain injury is a risk for ALS, it is unclear if mild traumatic brain injury increases rates. In 1994, the National Institute for Occupational Safety and Health reported non-significant increase in nervous system disorders due to 4 cases of ALS among National Football League players. It was unclear if this was due to chance or not. Another study from 2012 also found a possible increase in ALS in NFL football players. An older study did not find an increased risk among high school football players. A 2007 review found an increased risk among soccer players. ALS may also occur more often among the U.S. military veterans, however the reason is unknown. This may be due to head injury. After the 2012 report was released, some NFL players involved in the legal settlement with the NFL complained that the NFL, which initially agreed to pay $765 million, was not doing enough to help players. The judge in the case concurred, and the NFL then agreed to pay an unlimited amount of damages for players found to have ALS, Parkinson's disease, Alzheimer's disease and dementia. Brought to you by WikiVidi Documentaries. Would you like to know more?